When this came along, it really shifted my gears. And I thought, this is the next generation. This is where aesthetics, this is where wellness is going. This is where health in general is going. Stem cell therapy using a secretome approach to treat diseases. So aging and skin damage, diseased skin, the skin progenitor secretome seemed to be the perfect fit for regenerative aesthetics and moving forward in my practice. So I said, yes, I want that. I want that for my practice. Working with that for so many years now, I recognize that this product line, this secretome product from skin progenitor cells, moves the needle on outcomes for my patients more than anything else I've ever done, more than any laser or any surgical procedure I've ever performed.
Hello everyone, and welcome back to the Technology of Beauty, where I have the opportunity to interview the movers and shakers of the beauty business. And today is no exception. Today I have Dr. Laura Ellis of Lavellus here with us, who came up here to Manhattan Beach from someplace in Orange County. Where'd you come up from?
Laguna Beach.
Laguna Beach, one of my favorites, the art colony. Yeah, so, well, first of all, welcome.
Thank you.
It's great to have you here. We did a little brief one before, but this is the one in the studio, and I can't wait to get to know you better and your product, which is very ingenious. And so, first question, where'd you grow up?
Ooh, I grew up in North Carolina.
Uh-huh.
And I still have a home in North Carolina. I'm in Asheville.
Okay.
But I work all over the country.
Right, but you grew up in Asheville.
Grew up in Asheville.
And did you go to high school in Asheville?
Actually, I grew up in Greensboro, which is central part of North Carolina. Moved to Asheville 20-some years ago.
Okay. And where did you first go to college?
North Carolina State.
Okay. Cool. Mm-hmm. And thereafter, did you go straight to med school?
I did not go straight to med school. I worked at the CDC as a guest scientist in the epidemiology department, working in molecular biology there. Mm-hmm. And then worked in the private sector at Becton Dickinson, again as a biochemist, and then went to med school. Interesting.
Mm-hmm. So how many years were you at Becton? Or between college and med school, was that like 5 or 6 years?
3.
3, that's it.
Yeah,
okay.
That's it.
So then off to med school, and where'd you go to med school?
Chapel Hill, UNC Chapel Hill.
Sure. Mm-hmm. And then what was your residency in?
My residency was in general surgery.
Okay. So you did internship and 4 years of general?
Yes, so 5 years total.
Okay.
Mm-hmm. Mm-hmm.
So there you are, finished up after doing all those gallbladders and appies in the middle of the night and gunshot wounds and knifings and all that stuff. 5 years. Did you then do a fellowship after your general surgery training?
I did not do a fellowship.
Okay.
By the time I got out, after sitting at the bench for a few years and then going to medical school, I was 36 years old.
Uh-huh.
And I thought about fellowship, and I thought, I better go get a job.
So did you practice as a general surgeon?
I practiced for just a couple of years before I left the hospital and decided to go out on my own, yeah.
Uh-huh.
Mm-hmm.
And when you went out on your own, what did you go out on your own as?
I went out on my own as a general surgeon, but narrowed my practice to in-office work only.
Okay.
So I didn't have to go to the hospital anymore. This was a time when physicians were exiting the hospital. And so I opened my own surgery center.
Okay.
Practiced in my own surgery center, solo.
What city was this?
Asheville.
Okay, mm-hmm. Still in North Carolina?
Yep. Still in North Carolina. So, but I narrowed my practice to varicose vein surgery primarily.
Okay.
There was a new procedure at the time. It was an endovenous ablation type procedure that moved from the hospital to in-office, and I adopted that and loved doing that procedure and added aesthetics soon after I opened that practice.
So it started with varicose veins.
Yeah.
And then you just expanded with aesthetics, so that's cool.
Yeah.
And the whole time there in North Carolina?
Yes.
Okay. And then what happened?
Then what happened? Well, I grew that practice,
Yeah.
scaled it, replicated it here in California, so in Laguna Beach. I
Okay.
practiced there. And also another one in South Carolina, a second location in North Carolina, and then became medical director of some South Florida practices that modeled after mine.
All built on varicose veins and other aesthetic services?
Some of them we did do varicose vein surgery in some of those practices, but mostly wellness and aesthetics. So this was very early on before med spas were a thing. So we really just kind of developed an inside-out practice, we called it.
And about what year was that? Kind of the range. Give us
So
a feel.
2003 for the original.
Okay.
The next practice was 2012, then 2015, and then on after that, several.
And what was the connection to Laguna Beach?
Interestingly,
Besides, it's a great place to be.
I know, it's such a wonderful place.
Yes.
I hired a consultant in Asheville who was from Laguna Beach who said, oh, you know, we have a need for what you do in Laguna Beach, too. So I checked it out, and there was certainly a need, so I opened a practice there as well.
And you'd never really been there before?
Well, I'd done some consulting in L.A. County, but nothing in Orange County until then. Yeah.
Fascinating.
Yeah.
And does that practice still exist?
It does. We've expanded and moved into San Juan Capistrano now.
As in two practices or
No,
one?
we actually moved
You
into,
moved.
yes.
Do you still go to that practice?
I do, although I don't involve myself in direct patient care anymore as of a little bit less than a year ago. But I'm medical director and I still help manage.
Right. And still have the ones in South and North Carolina also?
That's
and
right.
Florida?
Yes.
Okay, cool. So how'd you get involved in skincare?
You know, in my residence, even in my medical school days, I would sneak away and work with the plastic surgery fellows and the head and neck surgery fellows at the end of my shifts because I just loved head and neck surgery and reconstruction and in the plastic surgery department, skincare. I did my research and publishing in my residency on CO2 laser resurfacing, endoscopic brow lifts, you know, all the head and neck reconstruction, and so I've always had a love for beauty and aesthetics and skincare, and did consider going on and doing a fellowship beyond general surgery, but as I said, I was, you know, I'd be 40-something by the time I got out, so I decided to stick with general surgery, and then it was just sort of a natural progression in my practice. Patients asked for cosmetic treatments, and I somewhat reluctantly added that early on. But that grew and grew, and I loved it, so I continued, and despite not being a dermatologist or a plastic surgeon, there's such a great opportunity for all physicians to get into wellness, and then that translates into aesthetics in many cases.
Sure.
Yeah.
So the wellness, the centers you're at, Laguna, North Carolina, and so forth, what other forms of wellness are you doing, like IV therapy or hormonal replacement?
Yeah.
What sorts of things fall into this wellness concept for you?
The wellness concept for me is basically 4 arms. One is nutrition.
Okay.
Another is fitness, stress management, and hormone replacement is a 4th arm there. I feel very strongly about hormone replacement as a basis.
And you provide that at all your centers?
Yes.
And what are the centers called? Is there one name for all of them?
MedAge is the primary centers. We had the one in San Juan Capistrano is called 161 Medical Aesthetics. You get that. And there are several different, there's a concierge practice in Raleigh, so they have several different names, but MedAge is the flagship.
Okay. And when did you develop your skincare line?
So about 8 years ago, I was introduced to Dr. Hans Kierstead, who is the chairman of Immunis and also the CEO of iVita Biomedical, biotech firms.
Uh-huh.
In these biotech firms, they develop medical treatments using stem cells and creating secretomes for various diseases, various organs. And so when I met Dr. Kierstead and he explained to me his research and development of secretomes and that he had just discovered a skin progenitor secretome method, that really caught my attention.
Uh-huh.
And until then, of course, I'd offered the typical skincare products in my practice.
Sure.
The peptide products and such. But when this came along, it really shifted my gears. And I thought, this is the next generation. This is where aesthetics, this is where wellness is going. This is where health in general is going. Stem cell therapy using a secretome approach to treat diseases. So aging and skin damage, diseased skin, the skin progenitor secretome seemed to be the perfect fit for regenerative aesthetics and moving forward in my practice. So I said, yes, I want that. I want that for my practice. Working with that for so many years now, I recognize that this product line, this secretome product from skin progenitor cells, moves the needle on outcomes for my patients more than anything else I've ever done, more than any laser or any surgical procedure I've ever performed. And when I combine it with those, it's amplifying my results. So I've really dedicated myself to helping develop this product line. And so that's where it originated. I met Dr. Kierstead. I learned about his medical therapies and how this applies to skin as well. And my own experience in my practice has proven to me that it is really it's this generation. I call it next generation, but it is this generation now.
So then you developed it along with the doctor, I assume, or the other physician you mentioned,
Mm-hmm.
and then I'm missing the step of commercialization.
Yeah. So the line was actually developed prior to my acquiring the IP for it.
Okay.
So although I didn't develop the line, I used this line in my practice and
see.
developed the protocols for usage.
Uh-huh.
And so as far as commercialization goes, iVita Biomedical and Dr. Kierstead developed the processes for testing the product line clinically and commercially, which is what they do for all of their IP.
Sure.
And then they license that IP to another company for true commercialization.
Uh-huh.
So they did market testing and gained traction in various markets, channels within the market before I licensed the IP. So I had all of that data, which allowed me to just take a startup at commercial stage
Uh-huh.
and begin that process right away, which I did this year.
Lucky you.
I know, lucky me.
And what's the name of your company?
The name of the company is Levelis.
Mm-hmm.
And
And
then
what's the name of the product?
the product is Provoke, and I brought you one.
Oh, fantastic. I
This
love
is
it.
the facial serum. Yep, this is for you. And
Okay,
I
thank
brought
you.
one for Erin too because
Oh, because you know she's going to steal mine.
that's right.
Okay, so now you said the product line. So what products do you have? You said the serum?
This is a facial serum.
Uh-huh.
The facial serum is a gel-like serum that can be used anywhere on the body, not just the face.
Okay.
Anywhere you have skin. I start with this because this is the hero product, as it's called.
Uh-huh.
However, we have formulations for neck and neck, body, even hair, eye. So there are additional preparations. There's even a formulation for a sterile in-office intra-procedure product, as I call it.
Okay.
And so those are all in the pipeline. By the end of this year, the sterile product will be available.
And do you have a sales staff?
I have a sales staff of one dedicated salesperson right now.
Okay.
However, I get involved with sales as well. It's a true startup company.
Right.
So we are a small company now, But gaining traction in the market and getting significant funding in, and do have a plan to bring in sales folks soon.
And now, if a person wants to buy it, do you have DTC availability,
we are
or how do you distribute it?
Yeah, strictly B2B for now, meaning we are selling our product to physician offices who then sell it to their patients.
Okay.
Ultimately, as we gain traction and credibility in that market, because it's a high science product, it's really not a direct-to-consumer product.
Uh-huh.
We will sell it through a DTC type channel. However, that will be strictly by us through our site, crediting physicians in that patient's area as we geolocate that.
What if a physician such as myself wanted to put it on our drugstore, put it on our website?
Right.
Do you have that ability?
Not yet. We want to be very cautious about that, protecting all physicians who are dispensing the product.
Uh-huh.
Diversion into other channels is quite a problem in some cases, so we want to prevent that.
Sure.
But ultimately, that will be possible, yeah.
Yeah, because I know, for instance, on my website, Sun Valley Aesthetics, we sell a number of skincare products that are only available in the physician's office or on the website.
Right.
And then they're drop shipped by the company to the patient. And I think that the finances, go through the company, but then they send us a little piece of that.
Right, exactly.
And
that's a great model.
That works out well for us because we don't have to keep the inventory.
That's right. So that's another option that we will have coming down, where you don't have to maintain an inventory, or maybe you want to maintain a smaller inventory.
Right, a smaller inventory.
Right, so you
Much
still get the
smaller.
credit for that.
Indeed.
Yeah.
Because once people are into a certain product, an example would be Nutrafol, which
That's
does
right.
not compete with this at all
Right.
for hair.
Right.
And they want it. The orders renew just like any sort of renewable.
They do
order.
have a good model. Yes.
Yeah, it works well.
very
And
good.
there's a number of other ones also.
Yeah.
So you have a number of these SKUs of products, and how do you Provoke? Provoke.
And
Yeah.
provoke is a bit of a play on words because,
Teach me.
yes, so in the stem cell science world, for instance, a pluripotent stem cell can be differentiated or provoked into another type of cell.
Sure.
Or a dedicated cell line for a particular organ. Say if we wanted to treat heart disease, we would provoke or differentiate that pluripotent stem cell into a heart progenitor cell. A skin progenitor cell. So provoke has meaning, and beyond just that, it provokes the skin to become healthier and younger appearing.
I love it. So people ask me, are there exosomes in it? And I know you said there are. And then they ask, where are the exosomes from? For instance, are they from the platelets? Are they from another patient? Are they from the same patient? Autologous versus non. Are they from celery? And so forth.
Right.
Where are your exosomes from?
Everything in this product, in the active, comes from skin progenitor cells.
Of humans.
From humans. What's important about that is you can collect a secretome or a collection of growth factors and exosomes from any cell population, from
Right.
platelets, mesenchymal cells of any origin, from fibroblasts. And those are great for wound healing purposes. If you want to address all aspects of skin health and growth and improvement, reversal of aging, reversal of some of the damage of the skin, you need the entire secretome. So the exosomes within the product are from skin progenitor cells. The skin progenitor cells come from a pluripotent stem cell. And those pluripotent stem cells are a single cell line donated many years ago, fully karyotyped, fully tested, and found to be pure. And then they're differentiated into the skin progenitor population, which is 99.6% pure skin progenitor cells, which are dedicated cells, sort of like a skin stem cell. And from that, we collect the secretomes. So the exosomes come from skin progenitor cells, so are specific to skin signaling.
Got it. From humans.
From humans.
Obviously not autologous because it comes from a single
Right.
donor or so
Right.
forth. Do they maintain their potency over time? Or do they lose potency?
That's a good question, because as you know, when it's called passages, right? When you collect the cells and pass them into another dish to grow them again, there can be some changes in the karyotype, or changes in potency, or changes even some of the cells die. So we do know exactly at what passage that begins to happen.
Okay.
And those cells are then discarded, and a new population is taken and provoked into a skin progenitor population. So that's a really good question, because that's a process that really should be followed by all companies who are collecting factors.
Just why I asked.
Absolutely.
Let me ask you another question. What level do these exosomes or secretomes deliver? If I put it on topically, at what level is it doing its magic?
Yes. So you're talking about depth,
Depth.
perhaps?
I'm sorry,
Okay.
depth.
Yes,
Depth.
yes. So what's important to understand, and this is a question that I get frequently, is that the skin is a barrier, and it has absorption functions as well.
Mm-hmm.
So we're talking a bit about absorption and penetration here for the actives. A typical exosome is 30 to 150 nanometers in diameter,
Okay.
and a typical hair follicle or pore is hundreds to thousands times wider than that.
Mm-hmm.
So, but it's a little more complicated than throwing a marble down a well, as they call it, because there are charges on the molecules that need to be taken into account. Maybe there's a lipid envelope that assists with penetration. But overall, it's not difficult for the actives to get into the skin. And there's a paracrine effect that happens. So it's not necessary to observe the factor getting into a particular layer if you see the effects affecting all those layers.
Mm-hmm.
So what's really important here is, what are you putting in there? Is that skin specific? Is it protected by a substance called fetuin A, which is one of the predominant factors within the product here that shepherds the molecules, meaning protecting them and allowing them to absorb into the skin. So several factors. It's, the absorption into the skin is not difficult, especially with the fetuin A, but also considering the size of the molecules that we're applying. And it really, what really matters is the end result. What do you see
Sure.
deep in the layers of the skin? So following a molecule into various layers isn't necessary if you see those changes or improvements in all layers of the skin.
And can you measure those improvements besides photography? Or can you measure elastin, collagen,
Yeah, ultimately.
histology, look at the cell rearrangement? Does it happen in the intracellular matrix, or does it happen extracellularly in the dermal level?
Yes and yes.
Yes and yes.
So what we've observed through third-party clinical trials that are published and have histology is that there's observed improvements from the stratum corneum deep into the extracellular matrix. Dr. Zoe Draelos performed clinical trials noting that there's 25% more collagen production 12 weeks after twice-a-day application at home, with no other products or procedures.
Is that the recommended dose, twice a day?
Twice a day.
Okay.
Twice a day. And that collagen isn't just collagen type 1. We're looking at collagen type 3 as well. So
Okay.
improvements in that the elasticity of the collagen, not just that structural type 1 that we often see after, say, a microneedling procedure or a laser procedure where we're creating little injuries, and the response is to heal from that, but there's a production of collagen type 1, but we don't see quite as much type 3. So we see a 25% improvement in collagen type 3 with just 12 weeks, twice a day at home, topical.
Fantastic.
I know.
Can this product be combined with any other product? We'll start with this sunscreen. Person puts this on in the morning twice a day. Do they put the sunscreen on underneath, on top? Does it interfere with the actions?
Doesn't interfere. The process is cleanse, apply what we call a foundational product, which is your regenerative product, this.
Uh-huh.
I recommend also an antioxidant to reduce free radicals that may form to environmental stressors.
So like a vitamin C?
Vitamin C or a retinol type
Retinol.
product, certainly. And then
And how much time between the application of this and, let's say, the vitamin
it
C?
dries almost instantly
I see.
and does not interfere with any other actives absorbing into the skin. So you can put things on immediately after. And then, of course, sun protection.
Uh-huh.
But moisturizers can be applied if necessary. But when
It doesn't interfere.
doesn't interfere. Does
What
not
about a
interfere with the
woman's
action.
foundation?
Some makeup?
Yeah.
Absolutely. So this is immediately after cleanser.
Right.
Then any other products you want to put on, makeup is fine. None of that interferes.
Okay.
In the study that Zoe Dralos did, cleanser, product, moisturizer, sunscreen, but those things did not have actives in them. And the results were based on those 4 products.
What if there are actives in, say, a subsequent product you're putting on? Let's say you're putting on one of the other brands of retinol or
Sure.
vitamin C.
Right.
And let's say there's an active. Let's say it's elastin or trihexapeptide or something
Yeah,
like
great
that.
products.
Yeah.
What I've
Would
seen
that interfere?
what I've seen in my practice over the 6 years that I've been using it is nothing but significant improvement. So no impedance that I can see.
Okay. That's great. And you have a sales staff of 1. You're a startup. Are you raising money
We are raising money.
for expansion of your sales staff?
Yes. The first thing, yes. So expansion of our sales staff, and we call them clinical educators because they're more than salespeople.
Sure.
They really bring education to the office. So yes, so we are fundraising. So fundraising, the funds will go to the sales staff, marketing, production, manufacturing, distribution.
That makes sense.
Yeah.
And what if one of our viewers, listeners, wanted to get involved or wanted to contact you? Let's say they want to invest in this. How would they get a hold of you?
They can,
Or your salesperson? I'm
Or
sorry,
my-
I just can't.
They can reach me through the website, which is myprovoke.com. They can also reach me directly by my email, which is drellis at levellis.com.
Okay, and Lev Ellis, LEVELLIS.com.
That's right.
Okay, great. I'm sure there are people right now wanting to get a hold of you, at least get their hands on the product, if not invest. And what's the size of your raise?
We are in a raise now. We're just starting our Class A round. Our $7.5 million is
Okay.
all. Yeah, it's all we need.
Okay.
It's really not a huge number to get us going. Our projections that we will likely need a second round perhaps in 2 years, but not much.
And did I hear you say you've been using this personally or in your practice for 7 years?
8 years actually, but I've incorporated various protocols for the past 6.
So this has been around a little while.
It has. This is nothing new. This technology is not new. In fact, Dr. Kierstead has been working with this master cell bank of pluripotent stem cells for medical applications for over 15 years. So the R&D on this product has been done alongside medical products, right? So even though as a cosmetic product, we don't have to do clinical trials. We don't have to meet certain standards that medical products do.
Right.
It's been done with this because why would he do it any differently in his GMP facility? So it does have a history, but the history is R&D, protocol development, third-party studies, and so fortunately, we don't have to do that as a company, which is why we commercialized within months of acquiring the IP. and have grown very rapidly since.
Yes, it sounds like that. You mentioned briefly hair. Can we go back to hair? Many of the
Yeah.
exosome companies have hair regrowth products of various types. Do you have a product that's geared for the scalp?
Yes, very exciting, and I've been using that in my practice for about 3 years now. The last passage of cells when we are when iVita Biomedical is growing them in the lab and harvesting the secretome for the
Okay.
skin from the skin progenitor cells. An application is applied where there's a biochemical process of cleaving from the cell membrane the membrane-bound hair follicle stimulating factors. They're very fragile, and if any detergents or solvents are used to extract, it destroys their biologic activity. So iVita has developed a proprietary method of cleaving them and protecting them with a cosmetropic trap, and then putting them in a serum. It's formulated, well tested by Thomas Stevens, the investigator in Texas who does so many of the hair studies. A drop or two of this serum is applied to the scalp daily for 30 days, massaged in. You can style and we can't tell or feel that it's on the scalp. And then there's a 30-day holiday, so it's cycled 30 days on, 30 days off. And it's proven to stimulate the hair follicle to produce hair. So Wnt signaling, noggin, sonic hedgehog, all signaling factors to activate the genes to transition the hair follicle from senescence into hair growth.
That's fascinating.
It is fascinating.
30 days on, 30 days off, and so forth. And when would a patient start seeing thicker hair or more hair? Or both?
Within 6 weeks, which is the growth cycle of hair, we start to see the little baby hairs coming in.
Is it villus hair? Is it real hair?
It's real hair.
Interesting.
Real
Does
hair.
it change any of the hair color characteristics?
That's an interesting question, and one that we are studying right now. So hopefully the answer will be yes to that.
Interesting. We had a guest, I can't remember now who it is, who was talking about the new hairs coming in dark because they had the melanocytes, but then they turned white again.
Yes,
But,
we'll see how that works.
It'll be interesting.
Yeah.
The hair market is just enormous, as you know, for both
yes.
men and women,
Yes.
as you know, post-COVID and all the rest. It's just fascinating to me how big it is on every level.
Yeah.
Topicals,
Yeah.
orals, light-based,
Well, and
injections-based.
we work so
PRP,
hard to grow hair because it's difficult to find one thing that helps. So we do so many things at one time.
Indeed.
But with this product, what we've discovered is, I like to make sure the microbiome is intact, and we're not, patients aren't damaging it by using products that are harsh, and that they're nutritionally fit. And then this product, along with measuring DHT levels to make sure that those are controlled, right, has been my standalone. So I used to do PRP injections, Kenalog injections. Oh gosh, how many things did we do to people's poor scalps? But I found that if I use this product with simply a dermal stamp, that I've seen patients who come in crying that they've spent so much time and energy trying to get their hair to grow, and finally they found something that actually works.
You mentioned the microbiome. There's some products that are just geared to the skin microbiome, like Thomas at Revance or at Crown, and they've got the product for what is the one? It's the microbiome Revive. I can't remember, but can that be used also with your product? You mentioned the microbiome.
I don't see why it couldn't be used. My concern with the microbiome is there's so many hair products out there, styling products and shampoos, that are harsh and can destroy it. So it's just like the gut, the skin, the microbiome that we make sure is healthy otherwise. So putting my patients on a healthy probiotic or on a medical grade probiotic, not just an over the counter, has proven really well in the skin and the hair restoration.
Fantastic. I didn't realize that.
It's very, very important.
Do you have a particular recommendation for that medical probiotic?
My favorite is Zymogen brand.
Okay.
There are different strengths. So if a patient has to be on an antibiotic for some reason, I put them on the broader strength probiotic for a month, cycle them on and off. It's not something you want to do every single day, so that's a cycle on and off as well. But there's a daily probiotic that I do recommend by Zymogen. And so I find that third-party certified probiotics are the best.
Is that prescription?
No, not prescription. But Zymogen brand can be ordered through a physician office, but it's over the counter but behind the counter.
Okay,
That
I
kind of thing.
understand.
Yeah.
Very exciting
Yeah.
news. Now, looking forward, I'm sure you have plans. There you are building this company.
Yeah.
What's the future look like to you? For you personally in this Levelis company, but also then just with aesthetics or skincare?
Yeah.
What's the future look like?
Well, I'm not in direct patient care anymore. When I recognized the power of this Secretome tool, I left patient care and decided to start this company and dedicate myself completely to it. So rather than taking care of one patient at a time, I can take care of thousands at a time. And I can share with my colleagues the next generation in regenerative aesthetics, in regenerative medicine. My goal is to educate that allogenic, when we're talking about proteins and exosomes, is not a problem. That autologous is an issue around, as far as immunogenicity goes, around cells and tissue, not around proteins. So what we really want to focus on is results. And how do you get results? If you back it up to what causes youthful, healthy skin, it's a youthful, healthy secretome specific to skin. We don't make all those factors anymore. So where are we going to get them? We can't get them from our own cells. We can try to squeeze as many good factors out of a large volume of blood or fat cells or wherever we source our mesenchymal cells, but they're just not going to have all those youthful factors. We just don't make them anymore,
Right.
in particular Fetuin. So a skin progenitor cell is where we have to gather our secretome and our factors. So I'd like to educate around that, because before the word secretome was even a thing, or even exosome in aesthetics, Dr. Kierstead was creating secretomes 10, 15 years ago. That was for the immune system, for the heart, for the spinal cord, for cancers. So this is regenerative medicine. This is just part of regenerative medicine, but it's a proven part. We're not at the bench anymore, so we're the ones we're the middleman, right? So we have to rely on those who know the science to provide us with that technology. And then I feel it's my responsibility to educate my colleagues. There's a lot of noise in this industry right now.
There sure is.
Getting through that noise is my mission.
Well, that's wonderful. Well, you've taught a lot of things to all of us today. It's been fabulous to have you on the show. And thank you for bringing Erin and myself the sample, or the
Absolutely.
full serum.
This is the
And
full
we'll
bottle.
be putting that on twice a day. And
Put it
hopefully
on
you won't
twice
even
a day.
recognize me the next time you see me.
Put it on twice a day. I'll put it on your little hand right now. You can feel it. It's so fresh. And that goes a long way. That one pump will cover your full face. Put it on your lids, on your lashes, on your lips, full face and neck.
Wow. That's a lot.
I know, right? Doesn't
Yeah.
it feel good?
And it goes
Yeah.
in so nicely.
Yeah.
Look at that. Okay. Well, happy trails. You're off to Laguna?
Off to Laguna.
Okay. How long are you going to
Yes.
stay here in SoCal?
I'm heading back to Asheville tomorrow.
Oh,
Yeah.
out of Orange County?
Out of Orange County.
Well, safe travels.
Thank
It's
you.
been wonderful having you here.
Thank you so
It was
much.
nice to see you at Scale in
Yeah.
Nashville. And what's your next meeting?
Oh, let's see. Tell All Tribune
Uh-huh.
and Genesis.
Sure.
Yeah, coming up.
Okay. Well, be sure to join us in Boston at the Aesthetic Society meeting.
I will.
And if you need any help with your exhibits or your booths, let me know. I am the chairman of the industry, and I can certainly help you. We'd love to have you exhibit there.
Thank
you. Really
you.
should be there.
Thank you. I think we're on schedule to do that.
Okay,
Yeah.
well, check it out.
Yeah.
Ask whoever's in charge,
Yeah.
and then drop me a line if you need any help with that. And
Will
I'll hook
do.
you up with Erica, and we'll have you prominently displayed there at the Aesthetic Society meeting.
Great.
Yeah.
Thank you. Maybe
You're-
I'll have salespeople by then, huh?
Yeah, besides one, you. No.
Exactly.
Let me know. By then, I'll
Okay.
look 20 years younger. Maybe I'll be your salesperson.
Yeah, well, you might.
I'll be your poster boy. I'll take some pre's and posts.
Thank you.
But I'm not going to do one half of my face. I'm going to do my whole face. Just in
Okay.
case it really works. Because I know it will.
Yes.
Well, thank you all very much for joining us on this exciting episode of The Technology of Beauty, where I have the opportunity to interview the movers and shakers of the beauty business. And Dr. Laura Ellis definitely qualifies. And I even got a product to take home. Provoke. Thank you. Thank you very much for joining us. And please go to YouTube and register The Technology of Beauty on YouTube and become a subscriber to our program. And you'll be eligible for a $10 million prize. Take care. Thank you.